First, today I am going to demonstrate to you a procedure in which we will be doing dry needling for tennis elbow. Now, tennis elbow is an extremely common cause of pain across the elbow. Patient report pain, especially on activities on outer aspect, that is here. Now, there are many ways to treat this. Usually we treat them with tennis elbow brace, activity modification, eccentric stretching. But even after that, if they don't get better, then you move on to next line, which most people will do a steroid or PRP injection. The technique that I'm going to show you is called dry needling, in which we are going to needle the common extensor origin in order to encourage neovascularization and take away the pain of the patient. So here we have a 41-year-old gentleman who has been having pain in his elbow for a while, and it's slightly better, but still he's struggling to do his day-to-day activities, especially when he goes to gym. So what we need for this is, all we need is some local anesthetic. So I have around 5 to 7 ml of 1 or 2% xylocaine. On this occasion I have 2%, and then you need a needle. So on this occasion I'm using a green needle. So on examination, I have marked the more tender spot. So I have used the tip of a 10 ml syringe, and I have pressed it so that I know which is the most painful area. So the first step for doing this procedure will be to instill some local anesthetic in that area so that you numb the area, including the periosteum, so that you can proceed with the dry needling. So just small prick. So just be gentle and go slow. Keep aspirating. There's no vascular structure there, but still it's a good practice to inject. So you want to inject a wide area that includes most of the common extensor origin. So once you have instilled the superficial bit, you go towards the bone and then inject close to the periosteum as well. Now once you have done the local anesthetic, you wait for a few minutes for it to act, and then I will show you how to do the dry needling. So I'm just going to take the green needle and then I am right onto the bone. So you just, through the same hole, try to penetrate periosteum, including the common extensor, and you can sometimes see the twitching. I saw the twitching once or twice, and this is just to increase the neovascularization in that area. And you need to warn the patient that occasionally they might feel the symptom getting worse before they feel it getting better. So I'm just going into the common extensor, ECRB, ECRL, and all the extensor and the periosteum, including the most painful area. So once you have gone in around 15-20 times, then all you need to is to just take the needle out and then just put some sterile dressing on top. This was a demonstration of dry needling in tennis elbow. Now once you have done the dry needling, you need to explain to the patient that pain may actually get worse for a few days. So I advise them to use anti-inflammatory and application of ice pack. You also need to advise them to take it easy for around 4 to 6 weeks. They still need to continue to wear the tennis elbow brace and do eccentric stretching of the common extensors. I hope you like this video. If you like this video, give us a thumbs up, do subscribe, and do share our channel.